right, today's question comes from a weird-ass snake who asks, how can I tell if I'm just extremely introverted versus if I'm schizoid? I looked into it and I relate to a lot of the stuff, but my mum says I'm just extremely introverted who doesn't go out because I'm insecure and afraid of the world. Okay, first of all, I am once again going to challenge the premise of this question, just slightly. You have more options than just introverted and schizoid. There are other conditions you could have. For example, avoidant personality disorder, autism, anxiety, and social anxiety is like a subcategory of that. Depression can also make you introverted, because if you're not enjoying anything, why go anywhere? Really distracting with the parents walking around. There's a few different options, and I don't know if this person has looked into it, but yeah, don't just look at schizoid. There are other options out there. What are the main differences? Well, if you're just introverted, like extremely introverted, if it's extremely, then that might be unhealthy. But if it's just introverted, like just being introverted, there's nothing wrong with it. You could be introverted and still function perfectly well in life. And if, what's the definition of a disorder? A disorder basically either causes yourself distress or distress to other people around you. Now, that's not to say that every time you piss someone off, that's a disorder. It's probably more than that, but for example, if you are hurting yourself or others, if your behavior is like really messing things up for your life or the life of people around you, like we're talking severe stuff, I'm sure someone can explain the difference better. But yeah, like if there's no distress involved either for yourself or the people affected by you, then it's not a disorder. You can just be introverted and that's fine. However, if your mum is saying you're extremely introverted, I'm going to guess that she thinks it's like over-the-top introversion, in which case you may have some kind of a disorder. And I don't know why she thinks that, just dismissing it as extreme introversion is a good thing. But the problem with parents, speaking of parents walking around, making noise, distracting me, parents, they don't always get it, and depending on how old they are, I don't know how old you are, I'm going to guess younger than me, just something about the way it's written makes me think younger. But like the older the parents are, the less likely they are to understand mental health awareness, because even when I was young, mental health awareness wasn't much of a thing. And it's more like in the past, maybe 10, 15 years that it started to really pick up more. But there's still a lot of people who don't understand stuff. Personality disorders are very overlooked, especially schizoid, because schizoids don't cause a lot of trouble. So, distress to self and others. I mean, schizoid's a tricky one in that respect sometimes, because people around you, if you're not affecting anyone, maybe that's not a problem. And then, schizoids, we tend to think that nothing is wrong with us. But I think, maybe it's also, maybe I should add in, like, the functioning in your life. If you're not really functioning in this stupid world we live in, maybe a disorder. I still think that I'm the sane one, and it's the world that's insane, but I have to live in this world, so whatever. But yeah, so I think, like, if you're just introverted, you can still function in this world. You're just happy in your own company, happy doing your own thing. I think introversion is slightly more correlated with people being less happy in their lives. Because extroverted people, they don't give a shit. They just go out there, and they'll only be sad if it's like COVID and they can't go out. I will be simplifying a lot of stuff because I'm doing this off the top of my head. But yeah, so introversion, nothing wrong with it. Extremely introversion could be an issue. Now, is it schizoid? Well, if your mum is saying you're insecure and afraid of the world, it's probably not schizoid. Schizoids just don't care. Not interested, don't enjoy a lot of stuff, don't feel like socializing, just don't care, really. Now, maybe you just feel depressed, but it's like I was saying, I don't like the world that we live in. I think it's crap. I'm stuck here. When you feel trapped, you can end up feeling depressed. But like insecure and afraid of the world, I don't think schizoids are afraid, they're just indifferent. If you're insecure and afraid of the world, I would say that's more likely to be avoidant personality disorder. Now, on a surface level, they can look very similar, but the key thing, it's same with autism, like the difference between schizoid and autism. I think it's like when we're looking at the social side of things, the key difference is like, why are you not social? So for autistic people, I talked about that a few videos ago. For autistic people, a lot of them want to socialize, but because of the neurodevelopmental difficulties in understanding other people and understanding social interactions, it can be, and like, you know, having to mask all the time, it can be quite stressful, quite difficult. They don't understand why their behaviors might be putting other people off, and so sometimes it's just easier to not socialize, not go through all that, but they want to socialize. It's just a hard thing to do. People who are avoidant, I haven't really looked into it that much because it's not relevant to me, but people who are avoidant, and it's sort of similar to like social anxiety, but as a personality disorder. Personality disorders are more deeply entrenched. Cut a long story short. But yeah, so if you're avoidant, like you're avoiding, it's in the name, you know, because the world is scary to you, and, you know, sometimes you're scared of being rejected or whatever it is. I'm glossing over it because I don't personally understand it. But if you are scared of all those things and you're not socializing because of that, that's avoidant. Whereas with schizoids, the reason for not socializing is just not giving a shit, not really having that need. Like the people who are avoidant, they probably do want some social interaction, but they can't find safe social interaction, so they just avoid all of it. Like everything feels too scary, anxiety provoking, whatever. But with schizoids, it's like, oh, why should I bother socializing? You know, it's boring, I don't care, I don't need it, I'm happy in my own company, like to an extreme degree. I would just rather keep to myself. You know, like why should I get off my butt to go and entertain someone else when I'm not personally interested? I hope that kind of makes sense. Like, there's different motivations. So think about your motivation for not being social. And if it's that you're insecure and afraid of the world, then maybe it is avoidant. But also look at autism. But if your mum is just saying that to dismiss you, which is entirely possible because I know how parents are, parents who don't understand mental illness, if she's just saying that, you can dismiss her just as easily as she dismissed you. And yeah, if it's just that you don't care and you relate to the criteria of schizoid, then yeah, you might have schizoid. So that would be my basics of how can you tell. How can you tell for sure? Probably go and get yourself properly diagnosed. Now, I know that's not always possible for everyone, so I've also made a video on self-diagnosis, and I've made some videos on whether or not you should get diagnosed. But I hope that helps with the basics. And, you know, dealing with parents who don't understand mental illness is tough. My parents are doing better, but there's still plenty of bullshit and, you know, conflict now and then. They don't expect as much of me, which is helpful, but every now and then, you know, things will blow up a little bit, and I've gotten a little bit more, like, you know, usually I would just keep shit to myself, but I've gotten a little bit more forward with some of the things that I think. Maybe this is from doing heaps of therapy, and, like, you know, talking to YouTube helps me as a therapy as well. I think I forgot to say that in whatever video I talked about therapy for schizoids. But yeah, so they're home. I don't want to say it too loudly, but there's stuff like, one of the recent things they do is to say that they walk on eggshells around me, which I don't think they know what that means, because when you walk on eggshells around someone, you don't tell them that because they might blow up at you. Like, walking on eggshells is what you do around people with borderline and stuff like that. I think they're just using it like to shut down me expressing discomfort. You know, I'm not allowed to feel grumpy. And this has been like a pattern through my life, particularly like after I'd been to a friend's place and they're like, oh, you just had fun, you're not allowed to be grumpy. And so, like, I wonder also if that's why I don't feel stuff, because I wasn't allowed to have emotions, so now I don't have much of any, especially not the good ones, because I was punished for having good emotions by not being allowed to have other emotions later. But yeah, this whole thing about walking on eggshells, I think it's to shut down the idea that I'm expressing what I feel. So that's the thing about parents, is they don't, like, I mean, I wish they'd get some help for their own issues, because, you know, if they really were walking on eggshells, we wouldn't have those sorts of conflicts, and I'd be able to say, don't do these things, please, and it wouldn't be like that. Yeah. Anyway, it's annoying because, like, I'm doing so much work with therapy and trying to figure my shit out, but if they don't get their shit figured out and I'm still stuck here, like, how much progress can I make? So, I feel you on the dismissive parent thing. I assume that's dismissive. That sounds dismissive to me. I mean, maybe the, like, you know, maybe she is listening. I don't know. It just sounds like probably not. And I know parents don't want their kids to have disorders because, you know, for one thing, it's another thing to worry about, but also I think they feel a sense of failure. And I think my parents do have a bit of a sense, like, I think some of the defensiveness, like the thing about saying that they're walking on eggshells around me, I think it's partly a defensive thing because they know that they failed me and there's some guilt there, but they haven't really processed it and haven't really come to terms with it and haven't figured out what needs to change for them to actually help me recover. You know, so instead there's this denial and dismissal, and it's not helpful because then I'm still trying to do all the work, trying to figure out how do I, like, now that I know more about how I got this way and why I remain this way, like, trying to figure out ways to deal with it, but it's still me doing a lot of the work on the emotional side of things. Very tricky stuff. Anyway, that's probably all I've got on this topic at the moment. But yeah, like, it's really also, it's hard for me to give you much feedback on this because, one, I'm not a mental health professional. I've just got a lot of issues and have been trying to deal with them for a very long time. And two, there's not really enough detail for me to know for sure. I think you're probably young. I think your mum is being dismissive from the way you've written it. Although the fact that you can talk to her about it, that's a step up from what I had, you know, when I first looked at all this schizoid stuff. Sure as hell couldn't talk to my parents about it. Can talk to them a little bit now, but I can see how uncomfortable they are, and I tend to fall into my pattern of protecting them, which I shouldn't do. And sometimes I don't, and that's when they say they're walking on eggshells, which, you know, walking on eggshells is like, you know, if you do one wrong thing, the person you're trying not to upset will explode on you. That is not what happens here. It's just like, because I've, like, you know, my depression and my mental illness has gotten to such a point, like, I'm actually getting worse as I get older. And it's gotten to a point where, like, I will just cry sometimes. Like, I can't control that anymore. Whereas in the past, like, if I felt that like that, I just, like, would be very shut off. But now I will just, like, I can't control it. I can't stop it anymore. I think, like, understanding more about my life, there's a bit of a grief for the life that I've lost. And my face just does the thing. I'm not always connected to the emotion. I don't know if this is a dissociation thing and, like, different pieces of my brain, like, as I process it, are starting to let things out more. So maybe it's something I just have to go through, because, like, you know, sometimes these things, it gets worse before it gets better, because you got to, like, relive stuff, get through stuff. I keep thinking of things that I'm like, oh shit, that was garbage too. I shouldn't have had to put up with that. And so, like, processing trauma, I think that's what it is, that I might be going through, is quite difficult, especially because I'm not safe. Like, you're supposed to get safe first, and I'm still in the same situation. My parents have only made tiny incremental changes gradually over time, and it's slow going with them, and they may never get to a point where they understand. But yeah, no, so I can just cry, and they don't like seeing me cry because they don't know what to do about it. It doesn't occur to them most of the time that they could just hug me, just comfort me like normal people do. No, they just get very awkward. Mum will tend to run off. dad stands around sort of, what do I do? And occasionally, like, you know, especially because I'm just trying to be more open, like, I will say morbid stuff about how I don't want to be here, and they don't. Dad's the only one who is usually around for that, and he has no idea what to do. You know, all this "are you okay" day bullshit. No one knows how to deal with it when you're not. It's just, I'm so tired of mental health awareness because it doesn't achieve anything, and there's just all these token efforts to help those of us with severe mental illnesses. And, you know, if I had been helped at a younger age, if people had noticed at a younger age, maybe I wouldn't have got this bad. So, you know, if you are younger and you can figure this stuff out early and you can get, you know, whatever treatment might be available, hopefully you'll end up in a better place than I am. Yeah. I always think I'm going to end the video and then I go on a bit more of a ramble. There's one more thought that keeps escaping me. What was it? Yeah, no, just on the topic of like these questions that people are leaving me, I'm trying to screenshot them as soon as I turn on my computer these days, because there are a couple of questions that have disappeared. So I'm sorry if I've like missed some. I am not deleting your questions. Either you have deleted it yourself or YouTube's bot has deleted them for no reason. So, you know, some certain words, I think the bot picks up, so be careful about how you word stuff. Also, if I don't answer or react for a while, please don't be offended or like feel awkward about that. It might be because I'm waiting until I have a chance to sit down and make a video for you, but if you delete your comment, it's actually harder for me, especially if it gets deleted before I have a chance to screenshot it. So, yeah, because there was one interesting one about some psychologists who theorize that schizoid is caused by, you know, the child being overly sensitive, except I don't know how they worded it. I can't remember how that comment was worded because I didn't screenshot it in time. So if you are watching and you want to re-ask that question, maybe I can talk about it because there was something really interesting there. And then there was another interesting comment, I think, but I tried to write down some stuff. Maybe that's the only one that I can remember. I think there was another question someone asked and it's been deleted. So yeah. I don't know, maybe I need to make like a form again where people can ask this stuff where YouTube isn't going to be able to delete it. I'm not sure, I haven't worked it out. But that's just like some general channel stuff. If you want more of this sort of question answer type rambling, and I know a lot of you watch for Schizoid. Also remember, I don't just have Schizoid, I've got depression and some kind of unspecified dissociative thing going on, which may be part of the Schizoid. We haven't figured that out yet, but it's not technically a criteria of schizoid, if that makes sense. It just might be intertwined with whatever's going on there. You know, psychology, these boxes, these labels, you know, you have to define them in some way because there's got to be some kind of a cutoff, but remember that people are all different. You too, weird ass snake. Remember that they're just labels. And we're all different, so like, you know, you could have more than one. You could have avoidant and schizoid together. You could have, I mean, autism and schizoid together, generally you wouldn't get diagnosed at the same time, but you can have overlap. You could probably have avoidant and autism, like there's all these combinations. So keep that in mind, there's overlap, and we're all slightly different. And with schizoid, I think you only need like 4 out of the criteria. You don't need all the criteria. And yeah, it took me a long time to get diagnosed. I think I talked about that in my first Schizoid Personality Disorder video. And I don't know, sometimes you just have to like be like, no, hey, here is how I fit them. And if they like if you go in and say, hey, I think I have this disorder, and they say, no, you don't, that's a bad sign. They're probably not a good therapist. What you want from a therapist is someone who'll be like, okay, I don't think so, but why do you think it? And then they can go through the criteria with you and you can explain to them why you think you fit. That is a better therapist, someone who will at least listen to why you think this. Now, they don't have to agree at the end, they just have to hear you out. And if they decide to give you a different diagnosis, you should ask them their reasons And if you think something doesn't fit, challenge them on it. But also don't be too stubborn, because sometimes we don't know what our own issues are. And it's hard because all these people, like, yes, they're the professionals, they're the ones who've done the study, but they are still human, and humans make mistakes. But yeah, if anyone just dismisses you, like your mum seems to have, you don't want that in a therapist for sure. Like, you can't do anything about your mum, but, like, maybe you could explain to her how to do mental health, not to just dismiss stuff, to maybe, like, at least listen to you more and, like, say, hey, but mum, I fit these things. Don't you think, and here's the difference from introversion, and here's the difference from avoidant, and here's the difference from autism, and here's why it is this. Oh, maybe one other thing, actually probably not in this situation, but another thing that looks like schizoid is schizophrenia with only the negative symptoms. It's sometimes called simple type schizophrenia, so you don't have delusions and stuff, you just have the more like unemotional type stuff. But I don't think that's what's going on here. But yeah, no, you can try and explain to your parents how to do mental health properly if you have that much of a relationship. My parents, I've sent them the things where they say, here's what not to say to someone who's depressed, and they still do a lot of the same shit. They're trying, but they're not really trying hard enough to make a difference for me in that respect. But yeah, if your therapist just dismisses you and doesn't hear out your reasons for why you think you have any condition, not just schizoid, run a mile. Although, if you bring up something and they believe you immediately, that's also a red flag, because you don't want someone who's just going to validate and affirm everything without asking questions. They should have some curiosity. They should do some differential diagnosis with you. They shouldn't just believe you straight up, because that's lazy, and they might have like a special interest in whatever disorder it is because they want to find that, and that can be just as damaging, because then they might misdiagnose you instead of just dismiss your diagnosis. So yeah, you need to find someone who's balanced, doesn't dismiss, doesn't immediately believe, but will actually go through in detail. And maybe that's how you figure it out. That video went on 10 minutes longer than I thought. I thought I was going to finish up 10 minutes ago. But now I feel like I've covered everything. Like, I sort of think, oh, have I finished everything? But my brain, some part of my brain is like, no, there's more to say. And it's only once I've gone on a bit more of a ramble that my brain's like, okay, now you're done, and now I can move on with my life. I've got a new rug here. My dog was wandering around before. I've got to read more notes about training him because he's got manners class. Gonna turn him into a good little boy. He's already doing so well though. Like, probably my best trained dog so far, dare I say. For a puppy, sure. There's still more for him to learn. But he's actually doing so well. So well. And there's some stuff that he already does better than any of our dogs did as adults. And there's some tricks he knows that I never taught. The other dogs didn't even occur to me to try teaching them. So yeah, he's doing really well. Anyway, what else was I gonna do today? I already did my banking, and I already updated my government shit because it's early in the month. Feel like there's something else. Oh, I need to go on a rant about phone stuff at some point. Anyway, no, this is like the end ramble. Is there anything to throw at you out of the blue? Because sometimes I like to troll people in my videos. The duck thing. I'll show you the duck thing in a few months, I guess, maybe. Now you can wonder, some of you know, but now you can wonder about the ducks.